And here to talk about health in communities like McDowell is Dr. Robert Bashford. Dr. Bashford, there are 80 counties in North Carolina that are designated as rural, and you are focused on creating opportunity for those places to have primary care physicians. Would you talk a little bit about your focus on rural health?
The focus began, Anita, 7 years ago when the Keenan Trust began a program putting young people out into rural North Carolina in primary care, forgiving a big portion of their debt so they could do it. What we learned going to Alabama, Wisconsin, was pick a kid from a rural setting and get him into med school first. Get him or her. Don't bring them into a different portal because you can't afford to have them fail out of med school. So we're 50 strong now, and we're doing the same thing with interprofessional, occupational therapy, physical therapy, allied health. We're doing the same thing with them.
So, back up for a minute for me. What was the problem you were trying to solve?
The problem is the problem that you're talking about, McDowell County. People in medicine tend to go to the interstates and live on 77, 40, and 85. They don't go into rural settings. So when you look at the state, look head on to the state, top right, bottom right, far left, there are no docs, there's no dentist, there's no mental health care, and everybody is sicker in rural areas than they are in urban areas.
And so, how difficult is it to identify those students and encourage them to start their practices in rural areas?
There's one thing I can do fairly well, and that's pick the kid that genuinely wants to be in a rural
And
space,
how do you do that?
because they talk funny sometimes, like I do sometimes, but they're smart. And they came from a rural space, and they love that idea of that community, and they want to go back there and be a part of a community. They want to be the vice mayor, they want to be on the school board. They want to be a part of a community, not just go to work and go home.
And what are the challenges that they're going to face?
We're going to face financial, which we're going to help with by forgiveness of debt. They're going to face all the challenges of what a family needs, schools, parks. I mean, they got to have all those things or they won't stay. And the community's got to want them to come. We've done some work with the Office of Rural Health and the Farm Bureau in trying to understand which communities will take care of these people when they get there. You can't just plop them down in a community.
And so you would affirm the work that's happening across McDowell County, which is under this umbrella of healthy places, but it includes public transportation and safety and strong schools and community activities, downtown festivals. All of that, I assume, creates the sort
It
of place
makes
where your students want to go
it,
practice.
it makes a community. If you don't have, for instance, and I'm electronically not privileged, but if you don't have broadband and you have to go to the Walmart or go to the McDonald's to do your homework, you're not going to live there.
Yeah.
So everything needs to be in place for people to live there. The community has to want to have them there.
So you mentioned broadband, and that causes me to think a little bit about the possibilities presented by telehealth or telemedicine. There may be some people who would think rather than trying to recruit medical students who will go to these rural areas, we could just use technology and offer health care to people everywhere in the United States, including the most remote rural places, via broadband. Does that work?
It's got a place. There is nothing that's changed about taking care of people that are ill. Being in the room with them makes the biggest difference of anything we do. But having said that, electronically we can get to more people. I'm a psychiatrist by trade, and we're going to have to get to people and their mental health, behavioral health issues through the provider. Me talking to the provider on a Friday morning about the difficulties he's had with several people in his practice. So it's a combination of both. Washington State has done it because it's such a broad area. Idaho, Colorado, they've done it because they can't get to them, so they've done so much telehealth. We're moving that way with some, but still boots on the ground. The doctor or the nurse or the patient navigator, the person that sees the patient and talks to them is going to be the most important interface.
Let's talk a little bit about patient navigators. In McDowell County, there is this program where they are using EMS personnel to go into homes, and rather than being responsive to the 911 call, they're actually trying to prevent it by these visits where they check on their patients every 2 weeks to make sure that their vitals are good, that they're eating what they should be eating, that they don't have safety issues, physical safety issues in the home. That's a very different way of thinking about providing health care.
We did it all wrong, and I'm part of doing it wrong. We treated people on the far end when they were sick instead of keeping them well on the front end. So population health has become so important. This person you're talking about, we can also keep them in their home. We can keep them in their home, and if you went, we talked about this, if you sent 3 or 4 people into a home to make a difference, you would send a nurse, a social worker, an occupational therapist, and a handyman.
Say more about that.
Okay. Occupational therapist is going to go help the older senior get back to Walmart shopping, get back into the world. The social worker is going to talk to them about the relationship they've got with their estranged children and how to manage that. The nurse is going to look at their meds, while the real player, the handyman, is going to be putting handles in their bathroom and on the steps and save their lives.
So here's the hard question. How are you training doctors to be part of that kind of ecosystem?
We pick them. First, we pick kids that think this way. I call them kids. We pick young people that think this way, that come into it thinking this way. Keeping people healthy being more important than treating them at the end when they're terribly sick. Health literacy, you have no idea what people hear when you talk about, say, diabetes. What do they hear? What do they know? It hadn't made them sick. So we want people that understand that the patient doesn't understand.
Right, right. And do you think the healthcare system in this move
Am I doing okay, Anita?
You're doing fabulous,
Good.
fabulously. Do you
I
think
need reinforcement.
we're good? Do you see the healthcare system in this move to value-based care basically supporting this direction
Yes.
that you're talking about?
Yes.
And how much confidence do you have, given how difficult it is to change big systems, that we'll get there in a way that supports the work that's happening in places like McDowell County?
We will get there because fee-for-service is not going to work forever. We're a very hard lot to change. I can talk only about physicians. We're difficult to change. We were trained in these rigid silos, and we're difficult to change. It's not going to happen in my lifetime fully, but it's beginning to happen. It's going to happen, and it will increase the care of the people in the rural area who get sicker with everything than urban residents.
And why is that?
Poverty, health literacy, access, but everything from suicide to substance abuse to hypertension, much higher in rural settings.
How optimistic are you?
I'm so optimistic, Anita, that I should be retired reading a book on the coast. For all the world, I should be reading and not doing this. I am so optimistic that this is what I've taken on, and I believe it because I'm seeing the kids, the young people that think a different way that are going to change this world.
Say a little bit about what's different about these
They are
incoming medical students.
They are. Well, I can talk about
How are
medical.
they different from you were when you were
incredibly
entering?
different. Incredibly different. I was focused on going to medical school and being a physician. I was trained in a silo. I never thought, until I got a little wiser, about asking a patient, what's in your refrigerator? Are your streets lit? How did you get here today? I did talk about domestic violence because I was an obstetrician gynecologist, but I didn't think about those things that really determine how somebody's life is lived. And these young people do that. They're an entirely different breed. They're smarter than I am, and I'm not modest. But they're quite a bit smarter than I am, but they're also quite a bit more savvy about people.
And so this is leading to the conversation about social determinants of health.
Okay.
Yes? One of the things that is difficult for community leaders in particular is there are so many social determinants of health. It's hard for them to figure out which 4 or 5 or 6 things we pick. How does a place like UNC Chapel Hill help a place like McDowell County work through that?
That's a harder one that requires more people thinking than me. But the example I can give you is the patient that gets to the clinic late and the doctor isn't aware, or the nurse or whoever sees them, of how they got there. How many buses did they change? How many babies did they have under their arm? What time did they have to leave home to get there? That's the more important question than what their eating habits are. Social determinants of health, transportation, access, all of the many things that change people's lives. Smoking cessation, for instance, in a community would change more lives and save more lives than anything else we do. I wish I'd have gotten a master's of public health. I didn't. I'm not going to now, but I'm learning about population health and how to take care of people at the front end instead of at the end. At UNC, we take care of people and do quadruple bypasses when that could have been averted had we gotten them at the front end.
What is population health?
Population health, this is a hard one. I knew you were going to do this. If we did this long enough, I knew you were going to do this to me.
I mean, you cannot use words like that without telling us what you mean.
I'll tell you what population health is to me. Population health is taking care of, I'm going to use another one, all of the social determinants of what keeps people healthy. That includes everything from diet to transportation to safety, all the factors that keep people healthy instead of treating them when they are sick.
What does that mean for how we evaluate success? If we're going to talk about population health, then what are the indicators that someone in McDowell County should be looking for to determine success? Because it's not just then how many people have diabetes, right?
Now, and I've got to add to what I said. It's stratifying populations too, so that you pick populations that you hotspot that are the sick population. Most of us are not, fortunately, sick chronically, but you hotspot who really needs the dollars and the assistance, and then the studies, and that's where places like the Shep Center are going to help us look at, and we've got tacked on to our project. Somebody's looking at outcomes. How many readmissions to a hospital? How many people have we kept out of the hospital anyway or coming to the clinic? How many people have we kept in their homes? How many people are leaving their homes? That I don't understand. I went to NC State and didn't listen in statistics because I didn't understand it and I didn't like it. But the epidemiologists and the statisticians are going to help us see if we're doing it right.
And all this keeps you optimistic.
Oh, I'm not an optimistic person, but I'm extremely optimistic about this because I know the learners that are coming in, and I know what they are made of, and they are going to make this work.
And you've got 50
primary rural scholars. We got 50. On the other hand, we've got a class running concurrently teaching occupational therapy, allied health, dentist, teaching everybody about interprofessional. Medicine is, the practice of medicine, the care of people is a team sport. I knew that early on because I was an obstetrician and I could not have done it without Tammy, my nurse. She kept me out of trouble.
I bet.
Oh, she looked at me funny. and she would
Everybody needs a Tammy in their life.
She would do that to me, and that meant you better pay attention.
What have I not asked you that you wish I had?
You haven't asked me about why NC State is so important to me, but that's a whole nother topic. It's a land-grant school. I went there. I grew up next door to it. I love it. I love UNC Medical School with all my heart. This concept of teaching people that are going to build bridges and grow food and take care of people in that way is close to my heart.
We are very lucky to have you in North Carolina.
I'm very lucky to be here. When I was in the 11th grade, my dad had a plumbing business. I said, Daddy, I've made up my mind I'm going to take your business over. He said, interesting, son, I made up my mind and you're not. My best favor.
We were lucky to have him in North Carolina,
too. Yep.
Thank you so much.
Thank you.